will decrease with increasing distance from the coil, right? And there are orbits, you have several indications where they ask for, MRI orbits or optic neuritis. There can be several complaints. Particularly, you do a diffusion weighted images and calculate the ADC values and push to PACS. But say, for example, there is a patient with Graves' disease or thyroid eye disease. In such cases, don't forget to do a diffusion in the coronal plane. And wherever you see a diffusion restriction, calculate the ADC and push those images to PACS. Okay. In orbital imaging, you have a special condition called orbital varix. Now, what is orbital varix? A varix is it's a lesion, it's a vascular lesion. Okay, it's a venous malformation that occurs because of increased pressure and because of the intracranial. It can be because of an intracranial underlying AVM or a carotid cavernous fistula or a dural arteriovenous fistula. If the consultant request or the clinician's demand or they're suspecting an orbital varix, maybe a routine MR in the supine will not be sufficient. So you need to know, because it's a mixture of, when you say varix, look at the second image, it's a mixture of flow voids, and you will have to demonstrate that. So what you need to do is you need to demonstrate in the supine and in the prone position. So when you if you see here, this guy, this 59-year-old person, his right eye bulges on straining. So what you need to do is put the patient in supine, do an imaging, and put the patient in the prone position. The straining will demonstrate the orbital varix. So this is known as the Valsalva maneuver technique in orbital imaging, particularly to demonstrate a varix. Okay? Right. Next, we move on to a very important imaging, that is MR cochlea. Now with the cochlea implant taking leaps and bounds, there are many congenital babies with congenital hearing loss, sensory neural hearing loss, working up for a cochlea implant. They need to give CT and MRI together, the details. So usually we do it as a package in our institution, and wherein the child will be sedated and we do an MRI cochlea and we do a CT cochlea together. The CT will depict multiple minute details of the osseous structures, whereas MRI will demonstrate the fluid-filled spaces and the vestibulocochlear nerve. So now this is a Fiesta sequence. Okay, you need to, now this is a Fiesta sequence where you can go for thinner slices. It's a 3D Fiesta sequence done in the axial plane where you will be able to appreciate